If you're over 50, your legs could be showing silent warning signs of early liver damage, long before you feel anything in your abdomen. Swelling, itching, bruising, or even subtle changes in your toenails might be your body's way of waving a red flag. The question is, would you recognize these signs before it's too late? Today we're diving into a crucial but often overlooked topic: 7 early liver damage signs hiding in your legs. Your liver is a powerful organ, quietly performing over 500 functions every day. But when it starts to struggle, often from fatty liver, viral infections, alcohol use, or years of silent wear and tear, it doesn't always shout. Instead, it whispers. And often, those whispers show up first in your legs. By the end of this video, you'll know exactly what to look for, why these signs happen, and when to act. Let's start with the most common one. Let's begin with one of the most common early signs of liver trouble, and also one of the most frequently dismissed: persistent swelling around the legs and ankles, also known as pitting edema. You might notice it after a long day, your socks leave deep marks on your skin, your ankles look puffier in the evening, or your lower legs just feel heavier than usual. Many people over 50 brush this off as a normal part of aging or blame it on standing too long. But here's the truth: while occasional swelling can happen, persistent, symmetrical swelling in both legs can be one of your body's earliest warnings that your liver is struggling. Here's why this happens. Your liver plays a critical role in producing a protein called albumin. Think of albumin like a sponge that helps keep fluid inside your blood vessels. When the liver isn't functioning at full capacity, whether from fatty liver disease, chronic inflammation, or early cirrhosis, it produces less albumin. Without enough of this fluid magnet, water starts leaking out of your blood vessels and into the surrounding tissues. And where does it collect first? Your lower legs and ankles, thanks to the pull of gravity. That's why liver-related edema almost always starts down low. A simple way to check for this at home is to gently press your finger into the front of your shin or just above the ankle for about 5 seconds. If you see a dent that stays for several seconds after you lift your finger, that's called pitting edema. Here's the important part. This type of swelling often appears months before more obvious liver symptoms like jaundice. In fact, some people don't feel any discomfort in their abdomen at all, even as fluid quietly accumulates in their legs. Now, swelling can also be caused by heart or kidney issues, or certain medications like calcium channel blockers. But when it's both legs, happens gradually, and is accompanied by other subtle signs like fatigue, cramps, or itching, liver function should definitely be checked. If you notice this happening regularly, don't ignore it. Ask your doctor for a liver panel and albumin levels, and consider a simple ultrasound if needed. Early action here can prevent bigger problems down the line. Remember, your legs are often the first place your liver whispers for help. Sign number 2 might sound familiar to many people over 50. Those painful calf cramps that strike in the middle of the night. You know the feeling. You're sleeping peacefully, and suddenly your calf locks up like a rock. You jump out of bed trying to stretch or massage it away. It's intense, it's sudden, and often it keeps coming back night after night. Now, leg cramps have many potential causes, from dehydration to medication side effects. But here's what many people don't realize. Recurrent nighttime calf cramps can be an early signal of liver dysfunction, especially in the context of other subtle signs. Let's break it down. Your liver doesn't just detoxify. It also regulates electrolytes, blood volume, and metabolic waste. When liver function starts to decline, these systems get disrupted. Fluid imbalances can lower levels of key minerals like sodium and magnesium, both of which are essential for healthy nerve and muscle function. At the same time, changes in circulation and nerve signaling make the muscles in your calves more prone to sudden, involuntary contractions. In people with chronic liver disease, including those who don't yet have obvious symptoms. Calf cramps are extremely common. In fact, clinical studies suggest that over 2/3 of people with liver dysfunction experience regular muscle cramps, often at night when circulation patterns shift during sleep. Here's something many overlook. These cramps often appear months or even years before a diagnosis is made. They're not just a nuisance, they're feedback from your body. So, what should you look for? If you're waking up several nights a week with painful cramps, if the cramps seem to be happening without clear triggers like overexercising, or if they're accompanied by other signs like swelling, fatigue, or itching, it's time to dig deeper. Blood tests that check electrolytes, liver enzymes, and sometimes ammonia levels can give clues. If you're already on medications like diuretics, especially for high blood pressure or swelling, those can worsen cramps if not balanced properly. Something to review with your doctor. In the meantime, practical tips like gentle calf stretches before bed, staying well hydrated, and ensuring adequate magnesium intake may help ease the symptoms. But remember, these are supportive steps. If your liver is the real cause, the only long-term solution is to address the underlying issue early. So if those midnight calf cramps have become a regular visitor, don't just live with them. Listen to them. They might be your liver whispering for attention. Sign number 3 is one that often flies under the radar because it doesn't look serious. Persistent itching on your legs, especially at night, without any obvious rash. I'm not talking about occasional dry skin. This is a deep, almost internal itch that can keep you awake, make you scratch until your skin is irritated, and leave faint marks on your shins or calves. You might try lotions or antihistamines, but nothing seems to give lasting relief. Here's why this matters. Itching can be one of the earliest signs of liver dysfunction, particularly when something called cholestasis begins. Cholestasis means the normal flow of bile from the liver slows down or becomes blocked. Instead of moving smoothly into the digestive tract, bile acids build up in the bloodstream. These bile acids circulate and irritate nerve endings in the skin, triggering that persistent, often nighttime itch. Why at night? During sleep, your body's temperature and circulation shift, and without distractions, you become more aware of sensations. Many people with liver-related itch say it's worst in the late evening or overnight. And here's the surprising part. This itching can appear months before any other symptoms, even before blood tests become dramatically abnormal. In some cases, it's the very first sign that something is off with the liver. Most commonly, this itching shows up on the lower legs, the palms, and the soles of the feet. People sometimes scratch their shins in their sleep without realizing and only notice the evidence the next day, little red lines or excoriations. Now, itching can also come from dry skin, eczema, thyroid problems, or kidney issues. But when there's no visible rash, when it keeps returning at night, and especially if it's paired with other subtle liver-related signs like swelling or fatigue, it's a big clue. If this sounds familiar, the smart step is to ask for liver function tests, especially alkaline phosphatase or ALP, gamma-glutamyl transferase or GGT, and bilirubin levels. These can reveal early cholestatic changes. In the meantime, avoid scratching aggressively as it can damage your skin. Keep your bedroom cool, moisturize with fragrance-free creams, and wear loose cotton at night. But most importantly, don't ignore this. Itching isn't just a skin issue. Sometimes it's your liver talking through your skin. Catching this sign early can lead to faster diagnosis and treatment. Sign number 4 might be hiding in plain sight. Easy bruising on your shins or calves, sometimes from bumps you don't even remember. As we get older, it's true that our skin becomes thinner and more fragile. But frequent or unusually large bruises, especially on the lower legs, can be a subtle but important early sign of liver dysfunction. Let's break this down. Your liver isn't just a detox organ. It's also a biochemical factory, producing most of the proteins that help your blood clot properly. This includes clotting factors and key proteins that keep your platelets working efficiently. When the liver begins to struggle, due to fatty liver, chronic inflammation, hepatitis, or cirrhosis, the production of these clotting factors starts to decline. At the same time, liver disease can cause platelet levels to drop, especially in more advanced stages when the spleen enlarges and sequesters platelets. Even in earlier stages, subtle changes in clotting efficiency can show up before other symptoms appear. The result? You might find bruises that are bigger, darker, or last longer than normal after a small bump. You might notice them on your shins, calves, or thighs, places that commonly knock against furniture or corners. Sometimes, you might not recall any impact at all.
Here's the important part. This isn't just a cosmetic issue. Easy bruising is your body's way of signaling that its clotting system may not be functioning at full capacity. In liver disease, this can happen silently for months or even years. Of course, bruising can have other causes too, such as blood-thinning medications like aspirin or anticoagulants, vitamin deficiencies, or certain autoimmune conditions. But if you're noticing an increase in bruising without a clear explanation, especially in combination with swelling, itching, or cramps, it's smart to get checked. Doctors typically order a complete blood count, CBC, to look at platelet levels, as well as prothrombin time, PT, and International Normalized Ratio, INR, tests that reflect how well your blood clots. Liver function tests often accompany these to give the full picture. One of the most encouraging things is that early liver-related clotting changes can often be reversed if caught early and the underlying cause is addressed, whether that's improving diet, reducing alcohol, treating hepatitis, or managing fatty liver. So if you find yourself bruising more easily than you used to, don't just chalk it up to aging. Take it seriously. Sometimes those purple patches are your liver's quiet SOS.
Sign number 5 is one that often gets blamed on aging, poor circulation, or footwear, but it can actually be a warning sign of liver damage. Numbness, tingling, or burning sensations in your feet, a condition known as peripheral neuropathy. Picture this. You're lying in bed at night and your toes start to tingle. Maybe it feels like pins and needles. Maybe it's a subtle buzzing or even a burning sensation. At first, it comes and goes, but over time, it becomes more frequent, and sometimes it even affects your balance. Here's how the liver comes into play. Over time, chronic liver disease, especially from alcohol misuse or hepatitis C, can lead to nerve damage in the peripheral nervous system. This happens for a few reasons. First, toxic byproducts that a healthy liver would normally filter out can build up and irritate nerves. Second, liver disease often leads to vitamin deficiencies, particularly in B vitamins like B1, B6, B12, and folate, all of which are crucial for maintaining healthy nerve function. Third, chronic inflammation and changes in blood flow can directly affect nerve tissue. In conditions like alcoholic liver disease, studies have shown that up to 50% of patients develop peripheral neuropathy over time. But even in non-alcoholic fatty liver disease, mild neuropathic symptoms can appear early, often before other major signs. The feet are usually affected first because peripheral nerves in the lower body are the longest, meaning they're the most vulnerable to damage. That's why numbness and tingling usually start in the toes and gradually move upward if not addressed. Here's what to watch for. Tingling or pins and needles in your feet, especially at night. Numb patches or reduced sensation on the soles. Burning pain, often worse when you're at rest. Changes in balance, gait, or an increased tendency to trip. Of course, neuropathy has other possible causes too, including diabetes, spinal issues, thyroid disorders, and certain medications.
But if you're experiencing these sensations along with other subtle liver-related signs like swelling, cramps, or easy bruising, it's a strong signal to get evaluated. A proper workup may include liver function tests, vitamin B panels, thyroid checks, and sometimes nerve conduction studies if needed. Addressing neuropathy early is crucial because nerve damage can worsen if ignored, but it often improves when the underlying cause, like liver dysfunction or vitamin deficiency, is treated promptly. Bottom line, tingling feet are not just a nuisance of aging. Sometimes they're your body's early alarm system, and your liver might be the reason it's ringing.
Sign number 6 is one that many people notice, but often misunderstand. If your thighs or calves are gradually getting thinner or weaker, even though your weight hasn't changed much, this may be more than just getting older. It can be a silent sign of liver dysfunction, specifically something called sarcopenia. Sarcopenia means the loss of skeletal muscle mass and strength, and it's a serious but often overlooked complication of chronic liver disease. In fact, studies show that between 30 and 50% of people with chronic liver issues develop some degree of sarcopenia, often in the legs first. Here's why the liver plays a central role. Your liver is your body's metabolic powerhouse. It regulates protein synthesis, stores glycogen, processes nutrients, and supports hormone balance. When liver function declines, whether from fatty liver, chronic inflammation, or cirrhosis, protein production drops, and your body struggles to maintain muscle. At the same time, liver disease can increase muscle breakdown. Elevated ammonia levels, hormonal imbalances, and inflammatory cytokines can shift your metabolism into a catabolic breakdown state. Your body starts breaking down its own muscle tissue, particularly from the thighs and calves, to meet energy needs. The result? Your legs become noticeably slimmer, weaker, and less stable. Some people describe their legs as shrinking or say they can no longer climb stairs, get up from chairs, or walk as briskly as they used to. The thighs and calves are usually affected first because these muscles are large, weight-bearing, and metabolically active. They respond quickly to both positive and negative changes. Here's a quick at-home check. Take a soft measuring tape and measure the circumference of your mid-thigh, about halfway between your hip and knee. Do this once a month. If you're noticing a gradual, unexplained decrease, especially alongside other subtle liver signs like swelling or cramps, it's time to take it seriously. Now, not all muscle loss is liver-related. Inactivity, poor diet, and aging itself play roles. But when sarcopenia happens despite reasonable activity levels, it's often metabolic. The good news? Sarcopenia can be slowed and often reversed with the right interventions. A liver-friendly diet that includes adequate high-quality protein, resistance training tailored to your fitness level, and medical evaluation can make a huge difference. Remember, losing leg muscle isn't just about appearance. It affects your strength, stability, and independence. If this is happening to you, don't ignore it. Your liver may be asking for help through your legs. Sign number 7 is one that most people never think to check, but it can be a surprisingly important early clue. Changes in your toenails, specifically a pattern called Terry's nails. Terry's nails are named after Dr. Richard Terry, who first described them in patients with liver disease. In this pattern, your nails, usually fingernails, but toenails can show it too, become mostly white or pale with a narrow reddish-brown or pink band near the tips. Imagine the nail as having two zones, a wide pale base and a thin, darker band at the end. This happens because of changes in the nail bed's circulation and reduced protein levels in the blood, both of which are common in liver dysfunction. Why toenails? Because your feet often reflect slow systemic changes. The toenails grow more slowly than fingernails, which means changes that show up there
often reflect longer-term metabolic shifts. Terry's nails don't cause pain, itching, or discomfort, which is why they're easy to overlook. Many people only notice them when clipping their nails or applying polish. But here's the crucial part. This nail pattern has been strongly associated with chronic liver disease, especially cirrhosis. It doesn't prove liver problems on its own, but when it appears alongside leg swelling, bruising, itching, or muscle loss, it adds weight to the picture. These changes occur because albumin levels drop as liver function declines. Low albumin alters nail bed vascularity, making the nails appear paler, almost milky. The dark band at the tip is due to relatively preserved vascularization in that portion of the nail. Terry's nails can also appear in other systemic conditions, such as heart failure, diabetes, or kidney disease. But in people over 50, especially with other subtle liver-related signs, it should not be ignored. Here's a quick check you can do right now. Take a close look at your big toenails in natural light. If more than 2/3 of the nail looks white, with a distinct reddish-brown band at the tip, and this is happening on multiple toes, it's worth mentioning to your doctor. Your doctor may order a liver function panel, albumin levels, and sometimes further imaging if other signs are present. Remember, Terry's nails aren't about vanity. They're a biological signal. Your nails can reveal what's happening deep inside your body. So don't overlook them. They might be your liver's way of leaving subtle clues at your feet.
So, let's recap. Swollen ankles, night cramps, persistent leg itching, easy bruising, numb feet, muscle loss, and nail changes. These may seem unrelated, but together they can paint an early picture of liver trouble. And the key word is early. The earlier liver issues are caught, the more reversible they are. If 2 or more of these signs sound familiar, don't panic, but don't ignore them either. Book a checkup, ask for a liver panel, get answers. Your legs may be whispering what your liver can't say yet. If this video helped you, hit like, share it with someone over 50, and subscribe for more evidence-based fitness and health tips designed for your stage of life. And if you want to learn how exercise can protect your liver naturally, tap on this next video. I'll see you there.